Senator Di Natale.
Thank you, Mr Acting Deputy President. Over the past year, I've made reforming the nation's dental health system one of my top priorities as a senator, and my party, in fact, has made it one of its clear priorities. In an agreement with the Labor Party to support it in government, it made sure that dental health was included as a significant part of that agreement. Why did we do it? We did it because there's an enormous need in this country to reform our dental system. We, as a wealthy country, have a poor oral health relative to our wealth. Cost is a huge barrier to treatment, and this comes at an enormous, there's not just an enormous health cost associated with this, but there's an enormous social cost. The chronic disease scheme was implemented because we know there's an association between poor oral health and chronic disease. We know that poor oral health is associated with greater rates of infection, malnutrition and so on, but it's not just a health issue, it's a social issue. People who are missing their teeth and are waiting for dentures, often for many years on public dental waiting lists, are less likely to get a job. Imagine sitting in front of a prospective employer, missing your front teeth, you're automatically behind the eight ball. The same applies to people who are looking for a property on the rental market. Real estate agents are more likely to make a value judgment about you if you're missing your teeth. I mean, that's a fact, and it's why this is one of the great reform challenges that faces this nation. It's right up there with other important reforms like the National Disability Insurance Scheme, and in my view, it will be one of the big reforms, one of the greatest reforms since the introduction of Medicare. Now, shortly after taking my seat in the Senate, I was approached by a number of dentists who were being audited through the Medicare Chronic Disease Dental Scheme. I didn't know much about the scheme. Despite being a health professional, it wasn't a scheme I had a lot to do with. But the more I learned about the situation, the more I met dentists who were having similar issues, who were in similar circumstances, the more I became convinced that something was seriously wrong. The Chronic Disease Dental Scheme was the first step for most dentists into Medicare. So I think what we need to do is explain how that scheme works. It was introduced by the Howard government. It's a scheme that essentially says if you've got a chronic disease, you see your GP can make a referral to a dentist, and you're entitled to about $4,200 worth of treatment over a couple of years. Now look, there have been criticisms of the scheme, and I'll talk about those shortly, but the scheme also has benefits. Firstly, we're getting an enormous public investment into dental care, and that's a good thing. Having public money invested in dental care is a good thing. 80% of people who access the scheme are concession card holders. So while there is a legitimate criticism around the notion that high-income earners might access treatment, let's be clear that the vast majority of people who access this scheme are concession card holders, 80% of those, and that's because there's an association between chronic disease and income. The criticisms of the scheme, as I said, one of which is legitimate, and that is that some high-income earners, only a minority, but some are entitled to treatment at the expense of other people who may need a treatment but can't afford it. There's also a question of the scope of service offered through the scheme, and should we be providing high-end services to some people rather than providing a broader range of services to more people and providing good preventative dental care, and that's a legitimate criticism. Look, what became apparent as I spoke to dental practitioners that have taken part in the scheme was that they were for the first time involved in a Medicare-type scheme. They had very little knowledge of how Medicare worked, and their entry into Medicare was very poorly managed. Now, the rest of us in the medical profession are very familiar with Medicare. We've been working in it for many years, but that's not true of dentists and dental prosthesis. In these circumstances where you've got a new group entering into essentially a Medicare-style scheme, the department's got a huge responsibility of making sure that's managed properly. And in our view, that wasn't done. The information that was disseminated to dentists wasn't done properly. We've had a number of inquiries into this matter, and it's very clear to me that while some of this information was communicated, it wasn't communicated as effectively as it should have been. Medicare is a very complex beast, and even for medical doctors, they often find themselves in trouble because of some of the complexity with the scheme. It's why we've got a professional services review board. And in this case, particularly with dentists, we've got to remember that we had a number of requirements placed on dentists that aren't expected of GPs. And it is my firm belief that many of the dentists who took part in the scheme, in fact the vast majority, acted in good faith to deliver services to people who were eligible for those services and in urgent need of those services, but fell foul of some of the administrative requirements under the scheme. Also think it's unfair that we've got practitioners who were required to repay the entire amount for the delivery of those services, despite the patient being happy, those services being provided well, and in many cases, those practices having spent considerable amounts of money in delivering the treatment when you consider the staff, equipment and other resources necessary to provide dental services. This is a problem that's resulted in enormous stress and hardship to a number of dentists, and it's, I think, fair to say that it has threatened the viability of otherwise thriving practices who are providing important dental care to the community. Now, none of us have got any sympathy for any practitioner who acts unethically, who seeks to defraud the department, but it is very clear, in my view, that the vast majority of dentists don't fall into this category. I acknowledge Senator Moore's statements about being familiar with the scheme, that it's important that dentists do that, but I think it is important to put on the record that the government has in fact used comments like fraud and rorts and so on for any dentist who has fallen foul of this scheme, and I think that language isn't helpful. Now, we have worked very hard on this issue. We've met with a number of dentists. We've made repeated representations to government on behalf of affected dentists, and I have to say I'm very pleased that we've finally seen an announcement by the government on this front. So during Senate estimates on the 29th of May, Minister Kim Carr made a very clear statement that included some of the following comments, and I quote, "What matters is the resolve of this department to face up to the mistakes and fix them and make sure they do not recur." And I think that's important to acknowledge, that they have acknowledged there's been some mistakes and that they intend to fix them. He went on to say, "It is our view that we need a retrospective change to the dental services determination within the near future that creates greater flexibility about the compliance arrangements while still protecting important principles of public policy. This retrospective change to the determination would bring the compliance arrangements more closely in line with other parts of Medicare." He went on to talk about the flaws in the scheme and said that the determination established different requirements and less flexibility in implementation than equivalent schemes in Medicare. Now, what that means is, in Medicare, you see a GP, services provided, you're essentially bulk billed or those services are charged through Medicare. In this case, unlike other cases, a referral was necessary to be made, or a referral from a GP was necessary to be made to a dentist, and in return that dentist needed to provide a treatment summary to the GP and also needed to provide a written quotation to the patient. In some cases, the dentists were not charging any out-of-pocket costs. Some cases, the dentists were salaried dentists, stood nothing to gain by, in fact, manipulating the scheme. And I can understand why some dentists didn't see the need to provide a written quote. It makes sense that in those circumstances people would have assumed that that wasn't necessary. And I go back to that point, that those requirements were not made clear to all dentists from the outset of the scheme, particularly considering this is a profession that has had very little experience with Medicare. Now, the truth is that the government is seeking to change the regulation that is going to enable them to revisit all of the audits, and I think that's very, very important. We're pleased that's going to happen, and we support the government in its endeavours in this review. I think now it's important to discuss the coalition bill, and I do acknowledge that Senator Bushby has worked hard on this issue. It is a somewhat unusual alliance, having the Greens and the coalition working together on an issue like this. But on this issue, I think it's a reflection of the fact that there's been something seriously wrong with the way the scheme's been administered in this regard, and in fact that there's been an injustice committed. We do support the intent of the bill, and the intent of the bill is that this injustice be remedied. We do, however, acknowledge that there are concerns around the way the bill's structured and in fact whether this bill would achieve its aims. We've had some advice that there are some serious problems around the way this bill is structured. But the bottom line is that in light of the Minister's announcement, where there is an intent to review all of the audits, and as a show of good faith, we are going to work with the government on their proposed solution rather than support this bill in the Parliament. I will, however, say that this bill could be revisited in the near future if, in fact, we don't get a resolution to this issue. We will hold Minister Carr to his word. He said that, in his view, it was his expectation that some, but by no means all, audit findings will change as a result of the proposed change or proposed review. Now, in our view, some means the vast majority. It's very clear that in practical terms, and I go back to the Minister's statements, the amended determination will trigger a reassessment of all audit activity. So far we know that there are 95 audits that have been concluded and 66 practitioners found to be non-compliant. What we know about those 66 practitioners is that the vast majority of those practitioners have delivered services, have delivered those services to patients who needed them, and that in fact they've been found to be non-compliant on the basis of a simple administrative error. That is, they've not sent a treatment summary back to the GP, or they haven't provided a written quote. Now, as I said, the vast majority of cases, that is an insignificant administrative error. And I have to say, as somebody who practices as a GP, not getting a treatment summary back from a dentist probably wouldn't make much difference to me. Well, at least I'll speak for myself and some of my colleagues. We wouldn't know the difference between a molar or an incisor. We're not, as GPs, we don't make good dentists. What we want to know is that a dentist has seen the patient and that work's been done and the patient's satisfied with that work. That's what's important here. So in terms of the clinical impact of these administrative decisions, in our view, it's insignificant. No clinical impact in terms of most of these audits. Now, we heard about some of the individual cases. We heard from Senator Bushby about Wilma Johnson. We've also met with Wilma and we wholeheartedly endorse Senator Bushby's comments. A number of other dentists involved in these audits: Helen Arabatsis, Roger Sharp, Dragon Antelis. Now, Helen Arabatsis, for example, a dentist doing terrific work in my electorate of Victoria, received notification that she would be audited, in fact then was asked to repay hundreds of thousands of dollars, threatening the viability of a dental practice, delivering important services to people in my electorate. It came at a time for Helen of a difficult time for her. She was, I don't think she'll mind me saying this, was heavily pregnant and facing a number of issues. And the way the government has handled this issue, I think it would be generous to say that it's been clumsy and heavy-handed. Now, the truth is we do acknowledge the statements from Minister Carr. I think it's refreshing in politics to see a minister admit that a mistake's been made and to then go on to say that it's the responsibility to rectify those mistakes. So we are prepared to work with the government in good faith in resolving these issues. It is our expectation, as I've said, that the vast majority of these audits that will be reviewed and, in fact, a different determination will be made. But we will reserve our right to revisit this bill in the future should that not occur. Look, the chronic dental disease scheme is far from perfect. I acknowledge that. We are working with the government in good faith to replace that scheme with something better. It's a fundamental reform, it's an important reform, and it's a reform that's necessary in a country as wealthy as Australia that can afford government investment in good oral health. We remain absolutely committed to reforming dental care, but we do believe that no potential reform will succeed unless the dental profession's consulted, it's fully engaged, and it's strongly supportive of any new scheme. And that's why it's critical we resolve this issue and resolve it quickly. It's important for the individual dentists involved, and I've mentioned some of those. It's critical for their individual circumstances, but it's also really important if we're going to go on and develop what is a national dental scheme that will be an important and significant advance in the health of Australia's community. So overhauling the scheme is still on our agenda. We're keen to work with the government to find a way to do that, to get a government-funded scheme that satisfies both the profession and the community. But the truth is that the response from the government on this issue has created many months and now years for some dentists of terrible stress and uncertainty. We feel for them. We hope they understand that our decision not to support this bill is a show of good faith and a sign of confidence that the government acknowledges that an error has been made and that they intend to fix it. The key task now is to continue working on the development of a new national dental scheme, to resolve the issue, and then to allow dentists to get back to what they do best, and that's providing critical dental care for the Australian community.